The origins of extensor digitorum longus are from the lateral condyle of the tibia, the proximal 3/4 of the anterior surface of the fibula, and the interosseous membrane. The fibers run inferiorly to divide into 4 tendons that insert onto digits 2 through 5. Extensor digitorum longus extends the metatarsophalangeal joints of digits 2 through 5. It assists in extension of the interphalangeal joints of digits 2 through 5. It also assists in dorsiflexion of the foot. It is innervated by the deep fibular nerve. The origins of extensor hallucis longus are from the middle of the anterior surface of the fibula and the interosseous membrane. The insertion is to the base of the distal phalanx of digit 1. Extensor hallucis longus extends all joints of the big toe and assists in dorsiflexion of the foot. It is innervated by the fibular nerve. The origins of fibularis longus are from the head of the fibula and from the proximal 2/3 of its lateral surface. The tendon of fibularis longus passes posterior to the lateral malleolus of the fibula and then medially across the foot to the sole. Its insertions are to the lateral surfaces of metatarsal 1 and the medial cuneiform. Fibularis longus everts the foot and assists in plantar flexion of the foot at the ankle. It is innervated by the superficial fibular nerve. Gastrocnemius is the large superficial muscle occupying the posterior compartment of the leg. Gastrocnemius has 2 heads, the medial head and the lateral head. The origin of the medial head is from the posterior femur, superior to the medial condyle. The origins of the lateral head are from the lateral condyle and the posterior surface of the femur. As they pass inferiorly, the 2 heads converge and give rise to the calcaneal tendon, which inserts onto the posterior calcaneus. Gastrocnemius plantar flexes the foot at the ankle and assists in flexion of the leg at the knee. It is innervated by the tibial nerve. Soleus is located in the posterior compartment of the leg, deep to gastrocnemius. The origins of soleus are from the proximal 1/3 of the posterior fibula and the soleal line of the posterior tibia. Soleus passes inferiorly and merges with the deep layer of the calcaneal tendon, which inserts onto the posterior calcaneus. Soleus plantar flexes the foot at the ankle. It is innervated by the tibial nerve. The origins of tibialis posterior are from the lateral surface of the posterior tibia, the shaft of the medial fibula, and the interosseous membrane. The tendon of tibialis posterior passes posterior to the medial malleolus of the tibia and inserts onto the medial surface of the navicular bone, the plantar surfaces of the 3 cuneiforms, and to the bases of metatarsals 2 through 4. Tibialis posterior inverts the foot and assists in plantar flexion of the foot at the ankle. It is innervated by the tibial nerve. The origin of flexor digitorum longus is from the posterior surface of the tibial shaft. The tendon of flexor digitorum longus runs posterior to the medial malleolus of the tibia and then passes to the sole of the foot, where it divides into 4 tendons. These insert onto the bases of the distal phalanges of digits 2 through 5. Flexor digitorum longus flexes all of the joints of digits 2 through 5. It assists in plantar flexion of the foot at the ankle and inversion of the foot. It is innervated by the tibial nerve. The origin of flexor hallucis longus is from the posterior surface of the fibular shaft. The tendon of flexor hallucis longus passes posterior to the medial malleolus of the tibia and inserts onto the base of the distal phalanx of digit 1, also known as the big toe. Flexor hallucis longus flexes all of the joints of digit 1 and assists in plantar flexion of the foot at the ankle. It is innervated by the tibial nerve.